On Tuesday, Hudson County View sat down with Janet Castro, the first Hispanic health officer in North Bergen's history.
Castro, who has a master's degree in public health, worked for the township for 11 years before being formally named health officer in January. During her interview, she explained how she made the transition from working for the State Division of Youth and Family Services to the North Bergen Health Department.
As a former social worker, I worked a mutual case with the health officer of North Bergen 12 years ago. And he saw something in me back then and offered me a position as a health inspector. Soon thereafter, I was sponsored by the township to go get my registered environmental health specialist license, and I worked in that capacity for 9 years. Then I was promoted to assistant director, and upon the retirement of my health officer, Richard Sansulo, a little over 2 years ago, I was promoted to director of the health department. So then I was appointed health officer January 2015 upon receiving all of my credentials.
Castro added that while she enjoyed being a social worker, the job took a hefty, emotional toll, and said being the North Bergen health officer is definitely more gratifying. Additionally, when asked what she thought about being the first Hispanic health officer in North Bergen history, Castro gave a succinct answer, thanking Mayor Nick Sacco for giving her the opportunity.
In this male-dominated industry, actually, I'm really thankful that the mayor had the foresight and the vision to appoint not only a female, but a Hispanic to this position.
Earlier in the day, Sacco offered high praise for Castro's work ethic and abilities.
You know, it comes from the hiring policy. We hire people from within. She is a resident of the town, and she worked very hard to get where she is now. I have a lot of faith in her. She's very, very skilled at what she does. She's on call 24 hours a day. She's a pleasure to work with, and when she goes to, to do her job, she gets it done.
So then just what are the expectations and the duties of the health officer on a day-to-day, week-to-week, month-to-month, etc. basis?
It is extremely extensive. I mean, she's responsible for the health and the health conditions throughout the township. I mean, everything from food inspections to debris in the yard fall under her jurisdiction.
Back at the North Bergen Health Center on 43rd Street, Castro talked about some of the duties and responsibilities of the department.
For example, we investigate health problems and hazards in the community. We conduct communicable disease investigations, environmental hazards. I'm sure you're familiar with the Ebola outbreak that our country was affected by this past year. And at the local level, we collaborated with the CDC and the State Health Department in developing protocols and monitoring the status of the travelers coming in from those affected countries. We also link our residents with valuable resources in the community. We collaborate with partners, and we ensure that our residents are connected to those resources, especially our more vulnerable populations.
She concluded by talking about an ongoing initiative the department is working on, a joint operation with the North Hudson Community Action Corporation to provide free adult vaccinations.
Actually, we are working on an adult vaccine initiative with our federally qualified clinic, North Hudson Community Action, to bring vaccines to the adults within the community. It's a free program. Presently, the state offers vaccines free of charge to children. This initiative will bring those vaccines to the adults in the community, and the township will be providing certain sites in conjunction with public health nurses at the clinic to offer these vaccines for free to the adults. So more details will follow.
I'm John Heides with the Hudson County View, the eye of the community.